AM 970 WSTX presents Straight Talk with Redfield. Now here's your host, Senator Holland Redfield.
We have with us here today Mr. Troy Dechabert-Schuster, who is the chairman of the Juan F. Hospital Board. And with him, we've got Philip Arcidi.
Arcidi.
Okay, Arcidi. Okay. Me and my own handwriting messed me up here. Okay. All right. See, Redfield doesn't have these kind of problems. He's got a secretary, a waiter, and a butler and everything behind him. But I just came in here with a skeleton crew, just me. Okay. But Arcidi, and as treasurer of the board and also the chairman of the finance committee on the board?
Yes.
Okay, well, great. It's great to have you both here, and we can talk about great things that are happening at Juan F. Hospital. I know it's a challenge in terms of the requirements for delivering health care here in the Virgin Islands, especially with the legacy of challenges that our hospitals have had over time. The bottom line is our glass got in water, and we want our glass to be full. So we're not focusing on how empty it is. We're focusing on the things doing to fill up our glass and deliver quality health care and to take advantage, hopefully, of wherever we can, the federal system of reimbursement, so we can get away from things like the unfunded mandate that basically healthcare is here in the Virgin Islands, since we don't get reimbursed for a lot of things. All right? So when we get done taking a break here, as I hear the music ringing in my ear, we're going to come back and they're going to take the floor and we're going to have a conversation. All right, welcome, and we'll be back. All right, we're back. Straight Talk with the other Redfield, Doug Canton holding down the chair, and we have with us Troy Dechabert-Schuster, chairman of the board, and Philip Arcidi. So, with no further ado, go ahead and introduce yourselves, and let's start this conversation.
Yeah, thank you, Attorney Canton, for having us here today and welcoming us to your listening audience, and to the listening audience, a very pleasant, good afternoon. And thank you for your interest in Juan F. Hospital, and we look forward to a very informative period of time with you today to shed some light on what's going on in the hospital and also to inform you of some of the upcoming developments. We have lots of exciting things planned for Juan F. and for the people of St. Croix. And Phil?
Yeah, and I wanted to thank yourself, Mr. Redfield.
Another Redfield.
No, Mr. Redfield too, I should say. But for inviting us up today, and hopefully to communicate with your audience and the people from St. Croix relative to what's going on in the hospital. Hopefully we can answer some questions and fill you in on all the good things that happen at Juan F. Hospital on a day-to-day basis.
Well, I'm gonna encourage you as much as possible to, give us the good news. Don't spare us the bad news. But definitely, one of the things that happens here is we have a lot of good news, but people are so busy dealing with the problems that the good news never comes out.
Yes.
So definitely,
Right.
And I think that's one of the really clear messages from the board here. The current board, one of our real objectives is to be as a transparent as possible relative to what takes place inside Juan Louis, the good and the bad, and to share with the public, because it is the public's hospital here, and we're here being elected officials by the governor and the legislature to direct it as best we can.
Yeah, so we have lots of great developments going on. You may have heard recently in the news about our pending partnership with Leahy Hospital out of Burlington, Massachusetts, which is right outside of Boston, and also Boston Children's Hospital. This is a very exciting opportunity for us here. One of the challenges that we face at Juan F. Hospital is being able to attract physicians, especially in all of the specialties that we need. There are certain specialties that we do need on this island that cannot be supported here on a permanent basis. The classic example we've been using as of recent is rheumatology. There are many people here with rheumatoid arthritis, but not enough to support a rheumatologist on a permanent basis year-round. So we're looking at this partnership with Leahy to help us to fill in the blanks where they exist. Leahy has had more than a 20-year relationship with Bermuda, where they provide these same services, and they send in specialists on a rotational basis, again, to cover areas of specialty that cannot be supported on a permanent basis. And patients are sent to the Leahy physicians on a referral-only basis. So you have to go to your primary care physician or your specialist that you're currently seeing and then be referred to a Leahy physician. Those Leahy physicians will be at Juan F. Hospital, and they will be seeing patients here locally and treating patients here in their hometown. We've seen many studies that show that there are always much better outcomes when patients are treated in their hometown versus a foreign city or a foreign country. In the event that a patient cannot be treated here, then they will be transferred to Leahy up in Boston seamlessly, so their local physician will have access to their medical records while they're at Leahy, will be able to communicate with the physicians at Leahy, and then when they return home, they will again be able to receive their files electronically and continue communicating with the physician who treated them at Leahy. So it's not like how people do it now, where they go to their doctor, they ask for a copy of their file and fly off to Florida, to Cleveland Clinic or some other such place and get treated, and then come back and there's no continuity of care. Also, Leahy, since they are an adult-only hospital, 18 years of age and above patients only treated there, they team up with Boston Children's Hospital. Backing up a bit, Leahy is one of the top 50 hospitals in the United States. Cleveland Clinic only made it to the top 100. So for all those people here in the Virgin Islands who think Cleveland Clinic is the mecca of healthcare, Leahy is even better. All of the national ratings put them in the top 50 in the United States. Boston's Children now, Boston Children's Hospital, they are #1 in the country and among the very best in the world. They receive patients from every part of this planet, treating them in Boston, and they only deal with the most complex and rare disease states. So they will be sending specialists here to assist our local pediatricians in treating children who have rare and complex diseases. Again, doing their best to treat the children here on this island, and in cases where they cannot be treated here because of lack of equipment, then they'll be transferred to Boston Children's Hospital seamlessly, again with the same exchange of medical records between the local physician and the Boston Children's Hospital physician, and then returned home and followed up. So this is very, very, very exciting news for us.
Well, when I hear this, two words that come to my mind. One is leadership, and the other one is vision. Okay, because when you go to Massachusetts and you talk healthcare, you're talking the big league.
Mm-hmm.
Talking the big league. And we had conversations with Dana Farber about a similar type of connection with the Virgin Islands. But the difference between then and now appears to be leadership and vision, especially when you look at what technology is doing to the world. It just makes it that much more necessary for you to be able to harness what you don't have here and bring it here in some vehicle, not just in the context of technology for the way they do operations and other diagnoses these days, but just in the context of this being a small place. And the fact of the matter is, if you have an ailment that just happens to fall outside the scope of what we have here in resources, all you want to know is that you can get the care you need. And through these partnerships, we can keep the continuity of care in the Virgin Islands. It's a no-brainer.
Yes. And that's the important thing, is that continuity, because when you look at a procedure that takes place, anytime you have the the pre-work done locally, and if the patient in the event needs to leave the island and go stateside, that after that patient has that procedure and can come back and follow up. If there's something wrong, what do? How do you have access to that service again? Do you go back to Florida again? Here, that doctor and that team will be seeing you again. So the outcome is going to be that much better overall. The other piece of this is we weren't looking for any kind of healthcare partner here. We wanted someone that could prove to us as the board that they have done this in other places. And Leahy Clinic has been extremely successful in Bermuda in providing these services for the last 20 years. The hospital there is government run, very similar to here. There is a lot of similarities related to the physicians there also. And when we took a look and evaluated what took place and the success Leahy and Boston Children's Hospital had there, that was the partner that the board wanted to move forward on and take a look at. When we bring up questions, it's very easy when Dr. Nestor was here, the chief medical director of Leahy, to say, okay, yeah, that happened. This is how we resolved it in Bermuda. So we feel that this will be a very seamless integration going forward. And the board has taken the position that we're going to move very slowly but at a good pace here. We're not looking at bringing 30 physicians in overnight. We want to really build up momentum here, make sure it works for all the parties involved, and especially for the patients that are involved, that they are getting top-notch quality care accessible to them in the Virgin Islands. Because this is about not only providing the best care we can possibly have here, it's about keeping our healthcare dollars in the Virgin Islands. We want to stop that dollar of ours either through health insurance for government employees or private health insurance leaving the island where it's so hard to earn that dollar. We want to reinvest it back into this community and the healthcare community. Right now our hospital does about $130 million a year gross revenue. The board wants to see this hospital grow to about $250 million. And how do we do that? Bringing those dollars that have left the island and keeping it here. And also, not only keeping our dollars here, but attracting others to utilize these services within this hospital in our strategic plan in the next 5 years of people saying, you know what, the best quality care in the Caribbean is at Juan Louis, due to those affiliations that are going in place. So it's a process. It's going to be a slow process because we want to do it the right way.
And also, Leahy and Boston Children's Hospital, they are challenging us to continue improving our systems. Everybody in the community knows that we faced a threat of decertification recently by CMS. And we are now beyond that. We had a very successful CMS survey in December of last year. And our certification continues with accolades from CMS.
It never ends.
It never ends.
It never ends.
It never ends. But also, we are now moving toward achieving deemed status with the Joint Commission, otherwise or formerly known as JACO, and receiving their accreditation also, so that will put us in a very, very, very good standing with CMS and an even better standing in the eyes of Leahy and Boston Children's Hospital. The CEO of Leahy's International and Executive Health Department made it very clear to me in a recent conversation that they want to see us continuing to improve our systems because they're not interested in putting their name on anything that's second rate. So we are in the process now of working with Joint Commission to achieve deemed status there and further proving to Leahy and Boston Children's that we can provide excellence in healthcare here, and then they will partner with us and help us to improve our systems also, so that we could be even better. So this is a very synergistic kind of relationship between Juan F. Louis Hospital, Joint Commission, formerly known as JACO, and Leahy Hospital and Boston Children's Hospital.
The board wants this hospital in a position that as surveyor comes in that institution, may it be CMS, may it be a JACO surveyor, that everybody isn't in a panic mode. That we are welcoming it, especially with a JACO survey. It's still different than a CMS survey because besides surveying, it's educational. They'll they'll share with you during the survey process what they've seen well in another hospital procedure or something that we're lacking. So it's much more informational. The survey process really puts us at a whole different level, and those are the areas that the board wants this hospital to achieve, and we must have in place. The JACO accreditation, and as Troy said, working with Leahy Clinic and Boston Children's Hospital, it isn't only the physicians with Leahy in this partnership. It's about our executive team and department heads being able to share with Leahy Clinic to say the CNO needs a policy on X, can contact the CNO at Leahy Clinic. If we're looking for a key position within the hospital, we can utilize their recruitment services. For our JACO survey, they'll provide us somebody to come through and do a pre-JACO survey before they the JACO survey team actually comes through. It sets the hospital up for very easy recruitment, because to bring a doctor into Juan Louis and have that partnership with Boston Children and Leahy, it adds to that individual's resume that they worked in an institution that has the Leahy name, has the Boston Children's name. It's really going to open up quite a few avenues for the institution, but at the end of the day, it's going to improve our patient care, because all those department heads and all those chiefs of services who are there, who are working hard, doing a good job, are even going to be tested even more so by the peers of Leahy and the peers of Boston Children's Hospital to what's going on. And there'll be a sponge of knowledge that'll be available to them, either being through seminars, educational activities between the two institutions. And Troy has also talked with the University of Virgin Islands Medical School about the medical school students being able to road around at Boston Children's Hospital and Leahy Clinic and having that accessibility.
Right, yeah, and thanks for that segue into the partnership also with UVI. We're looking forward to becoming a teaching hospital once the medical school at UVI is well established, especially in the graduate medical education for those who are doing residencies. And for residencies, it'll be not only the students in the 4-year medical degree program, but beyond that, people who are specializing, whether it's in internal medicine, pediatrics, what have you, and they can come study at UVI and do their clinical rotations and hands-on work at Juan F. Louis Hospital, and that'll be further facilitated by the physicians at Leahy and Boston Children's Hospital. As you mentioned, when you talk Massachusetts, you talk the big leagues. Well, Leahy and Boston Children's are teaching hospitals of Harvard Medical School and Tufts Medical School and other medical schools in the Boston area. So these are really world-class physicians who are already involved in teaching some of the best physicians coming out of the United States at Harvard and Tufts and those other fine medical schools in the Massachusetts, Boston area.
Well, I'm excited. All the things that you've talked about up to this point, I'm excited to see this move forward in a lot of different ways. Now, the challenge that you also have is for the average person up there walking the street that has to come into the hospital every now and then, otherwise takes it for granted. We have to get the word out to them also, because people jump on a plane and go for care out of the wrong misinformation as to what's available or not available here. So I think that it's great that you're here on WSTX to talk about the things that are going on, and make the rounds as much as possible, because the big challenge is getting information out. As great as WSTX is, and it's the greatest, the fact of the matter is there's some others out there, and they need a little attention too in the context of getting the word out. Because when it comes to healthcare, we'll be a leading team. WSTX leads the way, but we'll share. We don't have a problem with that. Anything else will be selfish, but when it comes to healthcare, definitely. Now, in terms of...
If I can just interrupt you for one moment, and that's one of the areas that we've the board have really pushed the executive team to public awareness of the good things that happen in Juan F. Louis Hospital. There's not enough of that information going out. So that's one of our campaigns that our chairman has emphasized in our executive team meetings, our board meetings, and our planning meetings to really get the good word of what's going on in Juan F. Louis Hospital out to the public. But we're not going to only get it, somebody said this was great or this outcome was great or testimonials. What we're going to back it up with is real hardcore data that's out there, that you'll be able to see the numbers, and the numbers don't lie to what's going on, how quickly a patient gets seen in the emergency room, how quickly the doctor was there, how quickly they were moved upstairs to a bed. All those things are going to be quantified with data, and we'll be releasing it so that you can see the improvement that is going on in this hospital.
Yeah, but definitely do the testimonials. You know, when you see in the obituaries, you see the thanks to the doctors and the wonderful care and so forth and so on. Let's move more to the live testimonials. Okay, it needs to be said.
Yes.
People need to hear it.
Absolutely, and it's a combination of both.
All right, folks, and you know, of course, saying the obvious, Juan F. Louis has a Facebook page. You want to know a little bit more about Juan F. Louis? Just jump on the internet and check out their Facebook page. You can give them feedback accordingly. You might see a few things you thought you knew something about and really didn't know. So check it out. All right, we'll be back in a minute.
6.
All right, folks. As someone I know, so I think I know, would say, we're back. Now, who's that? Alan, you out there listening in or what? Anyhow, we're here with the Juan F. Louis Hospital board members, Troy Dechabert-Schuster and Philip Arcidi, and we're talking about our hospital, things that are going on in our hospital, and a lot of good things that are going on in our hospital. And focus on the our. Don't knock it, folks. Build it. That's
right.
what you do.
That's
Build
right.
it, because you're the one that's going to need it.
That's right.
Okay. I don't care how much jet you got to go someplace. If you can't get there quick enough, which very often is the case, this is your hospital to do what needs to do for you.
Mm-hmm.
All right. Now, unfortunately, one of the places that a lot of us see our hospital in is the emergency room. Okay. And I remember the days of going into the emergency room and every seat taken, everybody waiting. And I'm happy to say that on the few occasions that I've had to go there recently, it don't look like that no more. Yay! Okay. All right. So obviously, you guys have been honing your operations, your registration process, the availability of doctors and everything in such a way that it's gotten better. So, but you tell me a little bit about that.
Yeah, so with the emergency room, you noted that you saw on our Facebook page during the break that we are trying to recruit more emergency room physicians, more trauma specialists, etc. The one challenge that we're always faced with is recruiting physicians. We're a small island, we're out in the Caribbean. Yes, it's a beautiful place to live, but we have many limitations here. And so it does pose a challenge for us to recruit physicians. Jumping back again, just to draw a contrast, with Leahy and Boston Children's, they're only sending in physicians primarily in areas of specialty that we can't support year-round. They will help once in a while with maybe an emergency room physician. But we do need many more permanent emergency room physicians. We need many more permanent general surgeons. The list can go on. And so we are actively in the process of recruiting physicians. But it's a real significant challenge, and Phil can offer more comments on that.
And currently the the way the hospital operated was they would bring in locum doctors, which is a collar doc. You pay them a certain amount of money. They're here for a very short period of time. They're not vested into the community, not really vested into the organization. And we don't want to have agency-type physicians in our hospital. We want to have individuals who live on island, who are part of our community. When they're out about the community, they see familiar faces that they know and can recognize someone walking into that emergency room. Because if you have a doctor who comes in from Texas and here for 2-3 weeks, they're not vestedly interested. And from our perspective, you always take a look at that doctor and why is he a locum? Why is he bouncing all over every state? Why isn't he someplace permanent? And unfortunately, it's not the level of physician that we're looking to bring in at Juan Louis. So one of the board's objective that Troy is stressing is to the CEO is we don't want any more locums. We want permanent physicians in our emergency room that know the people in this community and can recognize them and service them and have a vested interest there. And we're willing to make that investment because that's when you will see that emergency running like a finely tuned watch. That when there's the interaction of people knowing people who are walking in there. And those individuals, those patients walking to the ER can recognize them as community members.
And going back to something that Phil said earlier about keeping healthcare dollars on the island, the one thing we really want the public to know is that we do offer several outpatient services at Juan F. Louis Hospital. For instance, our lab, where we do the blood tests, urinalysis, etc., is already Joint Commission certified. It's a very, very fine lab. And we can receive patients who go to their private physician. They receive a requisition for a blood test. They don't have to go to the lab in Sunny Isle or any place. They could come right to Juan F. Louis Hospital, to our outstanding, highly accredited lab, and have the services performed there. They just come into our outpatient registration area, register right into the lab, have the blood drawn, and the physician will receive the results quickly. We have the best CAT scan machine, the best CT scan machine in the Virgin Islands, 64 slice. There is no other radiology service here that has a CT machine as technologically advanced as what we have at Juan F. Louis Hospital. So again, if a patient goes to their physician and needs a CT scan of their brain, of their abdomen, of their thorax, whatever, they can come in with that requisition and have the CT scan done right there at Juan F. Louis Hospital. We hear all the time of patients running to Cleveland Clinic to have a simple hernia repaired. We have outstanding surgeons right here on this island already, and we're in the process of recruiting even more. They can have their hernia repaired here or any other surgery they need done right here. So why do they want to spend the extra money to get on a plane, go away, get a hotel room, rental car, all of that kind of stuff, to have these services done and then have to recover in a very uncomfortable place? It's nothing like your own home and your own bed. They can do that right here at Juan F. Louis Hospital. We want the public to know that they should really avail themselves of the services that we offer.
Well, what I would recommend in that context, as a layperson, potential consumer, I don't want your services. I want to stay away from the hospital because I don't want to be sick, right? But, things happen. You have to go there. What you're doing is a kind of a comparison. And unfortunately, most of the time, we in the public hear about that comparison once in a blue moon when we hear you on the station. And it would be nice if we had just a little chart that you could stick in, let's say, on your Facebook page. Did you know? Okay, you can pay or you can pay. And just to show people that within the context of a particular type of procedure, because what happens around here. You hear about so-and-so, such and such happened, and they went away. And, in that context, that's their choice. But next time around, they'll be more informed that they didn't have to go through all of that. Next time when
Right.
they go away, it'll be to go and visit family.
That's right.
Or to go on a cruise.
Yeah, go away to have fun.
Exactly, exactly. So I would highly encourage that you do that type of thing on a kind of like a recurring basis for a particular procedure. That way people feel a little more plugged in that context, because otherwise you're fighting a rising tide. Look, Puerto Rico here advertising all the time for their hospital.
Yeah.
Okay.
All the time on our radio stations.
And hey, I love Puerto Rico, my brothers and sisters and family over there. I love Puerto Rico, but the fact is I live here.
Mm-hmm.
Okay? And I want to see these faces that I know in a job and here to take care of me. That's what I want. So
That's right.
I'm just saying in that context, that's I'm looking at the low-hanging fruit, not having to get a consultant to come in and charge you thousands of dollars to do. So I'm just saying, though, the average person out there, when they come to make that decision, what do they have for a reference?
Right.
And I'm saying that in the context, not all doctors know how to break it down, you know. So I would just sort of suggest that in the context of being able to possibly better inform the public about some of these considerations, so that they can look at it in that context.
And also, we want the public to feel confident in the level of service that we offer. You hear so many people saying, "Oh, I'll never go to Juan F. Louis Hospital." No way. But we do offer excellence in healthcare, and I'm a testimony to that.
Well, I know about your testimony, but you see, you have a name and people know you. It's the little guy out there that nobody knows, and all of a sudden, oh yeah, I know that guy. I saw him in Sunny and so forth. Those testimonials, get those testimonials in there.
Right.
And, do like Relay does and put them on Facebook, whatever. Right. Let people know. We got a caller here, so go ahead and take this call. Good afternoon. Straight Talk.
Good afternoon.
All right.
Yes, I'm calling. Yes, we have to get the word out. They might have some good doctors. But from my past experience, where I went in for dehydration, misdiagnosed by a physician assistant that was not even from here, and I was explaining to him my condition and what medication I was taking, and he insisted that I had kidney failure, and they was trying to treat me for that. Finally, my doctor, who was Dr. Perez, he told him no, he did not have kidney failure because I had seen my doctor about a week or so before. So, it goes both ways. We have good doctors, yes, but then we have some that, like you said, not from here. They don't care about the people here. You might try to make it seem like they do care, but they really don't.
Yeah,
they only need for a paycheck and for vacation. That's
yes.
what's considered down here to be.
Yes, but
if it wasn't for a local, I can't remember her name right now, the patient advocate, she was the one that came in to my room, explained to her what's going on, and came to find out the nurses did mistakes. I have hypertension, and they were giving me raw saline.
Yes, sir.
You can't do that with a person with hypertension.
Okay, I'm trying to get a word in edgewise here. I'm trying to get a word in edgewise here. I was curious. Were you listening to our conversation from earlier?
No, I was not. I turned on the radio just about maybe a half an hour, or less than a half an hour ago.
Well, I want you to know that this board, as what they express here, is a commitment toward having more local doctors. No more of these folks flying in and being here for 2 weeks and then flying back out. And all of this.
I did hear that.
Yeah, and all this is going to be on YouTube also. So anything I'm saying here, I'm not their legal representative or anything like that. I'm just talking based on what I heard. And I'm saying, so it's recognized that we have to raise the standard, step up, and make sure as much as possible that we can have that local factor play more of a role in terms of the interface with our patients, all right? So I think you're really on the same sheet. They're not saying everything is perfect, but one thing for sure, they're striving for higher heights, all right?
Yeah. So thank you for your call and the story you just shared with us. But that is one of the concerns that we did touch on earlier when we have lots of visiting physicians coming in and out of the hospital from the States on a rotational basis. They're not really vested in this island, many of them, and oftentimes they are out of touch with the culture. They treat our patients as just a number instead of a person, and as my colleague here, Phil, said earlier, we want physicians who are vested in this island, physicians who come to know the patients and their families, who really care about us, not who are just coming in for a quick job for 2 or 3 weeks or a few months and then they're back out again. So we are working on that expeditiously, and we will make that turn very, very soon. We're in the process of making that turn already to recruit high-quality physicians who will stay here on a permanent basis. And even the ones who do come in on a rotational basis from Leahy and Boston Children's, we know their caliber. We know that they're outstanding physicians, and so we are striving to provide excellence in healthcare for the people of St. Croix.
Well, you're really trying to turn a very sharp corner, and I say that the challenge is very great. I understand that, and obviously you've been listening, and I'm saying that not just this one caller, because I know the board didn't just wake up one day and say this is what we're going to do, but through whatever process you have to assess what's going on and to realize what's better, because in the long run, in the confidence of the community, building the confidence, these are the type of things that you have to do.
Yeah, and the real consideration here is you take a look at any healthcare organization, and especially a hospital, and you say, what drives care? What drives quality of care increasing it? And it's the physicians. The physicians are there as the eyes and ears of the board to monitor that patient care of what's going on in that institution and to drive that quality that's there. So without the top quality doctors in any one of those departments there, and administering and providing that quality of care, the hospital won't get to where we want it to be. And that's why our full commitment is to bringing in full-time quality physicians to deliver that service for our patients in that hospital. They are the key for that hospital moving forward.
Okay. Well, I want to throw out an invitation to you / the hospital. There's a lot of technology involved in healthcare and every other field, but in healthcare in particular. And I'm sure there are things that you're looking at, thinking about, and some things that you implemented. For instance, telemedicine, to what extent the hospital utilizes it now or is looking into the future in terms of that, or other types of equipment that will be replacing outmoded equipment in terms of bringing the latest in technology and efficiency and better outcomes to the hospital. And it won't be a talk about individual cases. This is about technology and where we're going in the future to develop our hospital and the type of standards that we'll be able to match any place else. Okay? Anyhow, we'll take a break, and I definitely want you to keep that invitation there in the back of your mind and hear the phone ring, and we can have that conversation ongoing, including your IT guy or girl. You know, the fact of the matter is it's not a guy's role. It could be anyone. But definitely the public would appreciate hearing a little bit, even though it might be a little bit on the geeky side. Hey, us geeks need a little love too, right? Okay. All right. We'll be back in a minute. All right, we're back, okay, with the Juan F. Louis Hospital board members, Troy, Dechabert-Schuster, and Philip Arcidi, and we're talking about various aspects of Juan F. Louis Hospital, plans, things that are happening, things that are on the way, and even things to come. I'm really going to lay out the red carpet to say that come again and come soon. And it doesn't have to necessarily be you. It might be to feature some of your employees that are working in a new area, specialty areas, things that have changed. The concept is to get information out to the public. This is not a lion's den or whatever, and even so, I hold the key to the cage, so no problem. But no, we welcome that, because the more the public understands what is going on in some of these areas. For instance, once upon a time, and this is a long, long time ago, medication was just kept in a closet somewhere. Now you've got dispensers that basically track how many times you take out medication or certain other things, so that when inventory is low, you don't find yourself needing a gauze and you're out of gauze and have to run down to the pharmacy and buy some. You know, you have a working inventory that tells you about those things. So that's old technology now. But I'm sure you guys have some new stuff you can lay on us here either today or in the not too distant future. Right?
Yeah, I mean, the hospital's always looking to utilize technology and make the practice of medicine easier for our physicians, our nurses, our technicians in the hospital. You know, since I've been on the board, there was a lot of basic physical plant issues that needed to be resolved at the hospital. Their generator, our air conditioning units that have been upgraded, issues with the roof there. Our board chair has been very successful with our CEO in really pulling in a lot of grant money into the hospital for being able to do those type of things and have those funds not coming out of our operational account there, which has been a tremendous asset. But we have a joint conference committee with the doctors that the board sits down with the key chiefs of service of physicians throughout that hospital on a quarterly basis. There's a very strong interaction with those doctors and what kind of technology advancements or equipment that they feel that would be able to provide better services to our patients. So that dialogue is always going back and forth. And as it relates to the IT services, the running of the hospital and their financial system that we have in place has become antiquated to what the other hospitals are doing stateside. And that's one of the areas that we'll be focusing on. Right now we can share electronic medical records, but we can be on the same platform as Boston Children's Hospital, as Leahy Clinic, in sharing that information. My goal as the chief as chair of the finance committee here is to really break down our income statements and to allocate cost and revenue by revenue producing departments. Okay, what is the dialysis actually doing for us every month? What is the VICC actually producing each month? What is the outpatient services doing? So that we could really take a look at what's contributing and what's not contributing here so that we can really meet our cash flow needs. And what needs to be corrected, be able to go and correct it. Our reporting system does not allow us to do that. But that's some of the technology we want to be able to really target into on going forward.
We have some exciting things on the horizon, on the very, very, very near horizon, actually tomorrow. And I'll let Phil talk to this. This gets a little bit technical, but he will break it down and make it as simple as possible. But we have a great opportunity right around the corner to make a lot more money from CMS. And that will really catapult us into the future financially. So, Phil, tell us about the TEFRA rebasing.
Yeah, so basically the Governor Juan F. Hospital has been reimbursed through Medicare. For every Medicare beneficiary who comes into that hospital, our hospitals on the Virgin Islands get reimbursed on its TEFRA methodology of reimbursement on, and it's part of the tax equity.
Formula, basically a formula.
A formula.
An old formula.
Exactly. And none of the stateside hospitals get reimbursed the way they get reimbursed on a DRG methodology. And actually being a TEFRA reimbursement based on cost is much more appropriate for the Virgin Islands. The problem is with our reimbursement relative to our cost reimbursement is that they're using a 1996 base year of cost. So they take our cost in 1996, CMS, and they inflate it each year for medical consumer price index of inflation, and they step that up and pay us currently based off that 96 cost. And what that equates to is really not making more money off of CMS, but trying to cover our costs of providing services to our beneficiaries that are there. Currently, the hospital runs at about 65% of charges, and that's where our contract insurers are paying us in that vicinity, based on that charge structure. Medicare, if you take a look at what they're paying us on charges, they're only paying us 35 cents on those charges. So on every dollar that we charge, Medicare says, based on that form, we're only giving you 35 cents. Well, as compared to what we're operating at cost is 65 cents on a dollar. Now, we have a meeting with CMS because we put together as a board, asked for a rebasing. This has been requested over the years, but I think at this point in time we have the best possible backup to be successful. And we're not looking for anything more than our reasonable cost as calculated on a Medicare formula and off our Medicare cost report. And remember, the hospital has to send in a Medicare cost report every year that's from our outside auditors put together. Our own financial people can't do it. And that's the standard for every hospital, that there's independent certified audit that needs to be put together for that cost report. So we're looking to be paid more appropriate cost. And basically right now we have a cap. So every patient that comes into Juan Louis, Medicare ends up, after everything goes through and settled on the cost report, we have a cap of $10,000 per discharge for a patient that's coming in. Our cost runs about $18,000 per discharge. So we want to get more to the 18. And why does it run so high? Because our length of stays runs longer. We don't have any skilled nursing facility beds on St. Croix. Currently, the only skilled nursing facility beds are sitting on St. Thomas at Seaview, and we know those issues that are what's going on here. There's no Medicare home health care services any longer on St. Croix. That has been discontinued. So the hospital's faced with holding these patients longer, so it raises our costs. If we were a stateside hospital, we'd be able to discharge. We discharge to a skilled nursing facility for a 20-day stay with rehab. We don't have those services here, so some of those things drive up our costs. But I just wanted to give a couple examples of where we were at cost relative to the cost we're spending now. And the way you get this them switching your base year of costs, and where we're looking to go from 96 to 2013, is demonstrate cost beyond your control at the institution. And I think one of the main ones is we all very familiar with electric costs because we all pay our own homes, our own business electrical costs. In 1996, what's in there for our base year cost reimbursement is $938,217. Well, that cost doesn't hit 25% of what our expense that's running out of the hospital due to the increases in electricity rates. Currently, the hospital's paying its annual electricity bill for 2013 was $4,870,000, $870,000 in electrical costs. So every patient that comes into the hospital, Medicare isn't paying their fair share, because what happened in 1996 to what's happening in 2013 and where expenses have gone relative to electricity is beyond the hospital control. We buy it from Whopper. We're not going to be paid appropriately within our rate, and that's one of the reasons why we're asking for a Medicare rebasing. When it comes to drugs, and we all know drugs and pharmaceutical costs and the latest of antibiotics, and I'm sure Mr. Schuster, having a pharmacy, can talk to that, and the latest drugs. In our base year of 1996, we are receiving $804,237 worth of expenses for drugs in 1996. Our costs in 2013, and we have the best contracts with McKesson and the pharmaceutical companies there that we get good hospital pricing because we're a government hospital, probably no better than anybody else. We spent $2.5 million in drugs. That's not any inefficiency with the hospital. That's pure drug cost on what's flowing through.
300% over.
Exactly. Mm-hmm. That's what we're making up. That's why we're trying to rebase it. In 1996, you were talking about IT costs. What we're being reimbursed is $148,000 a year in IT costs. I wasn't around in 1996, but I don't think technology-wise what's required today compared to 1996 for that institution to be able to do business is totally different. All our x-rays are read electronically, our financial systems, just email, all the other costs associated with that. Our IT expense runs in 2013 $1,317,000. So those are a few basic areas where we need to have our costs stepped up to a more appropriate year.
Well, I think you made a very good point of outlining and showing us in a demonstrable way that what it really costs and what we're being reimbursed are way out of sync.
Right.
And what you're telling us is you've got the right argument at the right time and the right documentation that CMS and everyone else is going to look at these things and say, hey, folks, we got to change the way we come up with these values because this is not working to affect health care. It's working against.
Exactly. And Medicare is a cost-based reimbursement based on our methodology. We're getting paid half of what we should be getting from Medicare. Well, now you say, what does this equate to? Probably equates to $8 to $10 million a year if they were to give us our fair costs, bring us forward to the 2013 year.
Okay. Well, let me ask you this: should we perceive, let's say in this case, Medicare as being hostile to the Virgin Islands? Like, are they comfortable to keep us where we are, or do we really have an opening here where they can see it our way?
Well, I think they're seeing our world because remember we passed the CMS survey with flying colors in December, and they fully certified that institution, so they know the quality of health care is there. Now it's basically taking a look and saying, let's pay the fair share of what they're responsible to pay. They have taken this very seriously because, as our board chair has just stated, there's 8 people from CMS who just deals with finances meeting in Washington tomorrow with the hospital CFO, Tim Lessing, our hospital auditor, BKD, who's audited all the books, who's there to say this is truly their cost on an independent, and BKD probably does, I'd say, about 500-600 hospitals throughout the country. And our attorney that we've hired representing the hospital, Deborah Gardner from Ropes and Gray, will be putting forth that argument. Myself, I'll be on the phone with them as well as Troy. So they've taken it very seriously to try to go forward and assist the hospital in getting paid their representative cost of what they should be. We can't admit Medicare patients that we've all paid into Social Security, and all residents here to say, you know what, I paid into Social Security, and guess what, federal government, you can pay my hospital half of what you're supposed to pay them. Because that's how this hospital keeps getting into the deficits over the year. Nobody, taking back to 1996, and taking a look at who was president at the time and what type of phone we were using, it isn't even close to being a representative year of what's happening in the Virgin Islands.
Well, in terms of Medicare, in terms of the national budget, is there any politics that we have to wade through in the process of making this argument? I'm just curious. from your side of it?
I
On
mean,
a national level.
I think it's always great to get support. I've had a discussion with Governor Mapp. He's extremely supportive of this issue and is very well aware of what's happening here. Relative to the political side, that helps, but I think the numbers to what's taking place here really demonstrates the facts of what's happening. And also, when you take a look at this, it's, you know what, let's do the right thing. This hospital's been suffering from under reimbursement for a number of years. We look back that this started going out of kilter around 2000. So for the last 16 years, this dramatic underpayment has been taking place.
Well, you know, America can't tell where the next rocket scientist who's going to invent fusion in terms of making it an everyday part of power production and so forth. That child who could grow up to be that brain that accomplishes that could be born here in the Virgin.
Alexander Hamilton came from St. Croix.
Exactly. and this is one of the things why I asked about the politics, is because we've got to get real that as a nation, every life matters to achieving the end of greatness.
Mm-hmm.
And when you have disparities in healthcare opportunities because of how the federal government looks at the dollars, the fact of the matter is a sickness here and a sickness in Atlanta is still a sickness. It's not a difference because you're in a different location. So I'm hoping that we can see more equalization of that consideration on the national level and say that resource-wise, the Virgin Islands matter just like any place else. We just don't know where the things are going to come from, so we got to take care of all the good. All right?
Well said.
We'll take a quick break here and back in a minute, and then we can work toward all the other things that are tugging at you that I know you have to run out of here today. Right, we're back. We're back here, WSTX AM 970, 773-0390, 773-0490. Of course, we've got all of those folks out there on the internet who are listening using their computer, tablet, smartphone, tune-in app, or whatever other app you use to catch the streams out there. And we want to welcome you to WSTX, and at the same time also tell you to spread the word. You got any family out there going away, make sure they've got that app on their phone so they can keep in touch and get a taste of home when that loneliness kick in, okay?
Yeah.
I say that I'm fortunate to have my mother here visiting, all right? But between the source and streaming, she's calling me and said, Doug, you know about such and such, and it's like, wait, you up in Massachusetts to call it? So, yeah, technology has gotten us a long, long ways, and it's really great for those grandparents who can see the grandbaby just as they come out the hospital or even in the hospital, instead of having to make that trip out to California just for that reunion at that time. So a lot of great things happening in technology. I know that I'd be taking a chance to ask you if you have any special people that you want to send shout-outs to in terms of the hospital staff. I know the whole hospital, because they're all doing a bang-up job to get you where you need to go. But I'm just saying in the context of, any kudos you want to throw out to anyone or acknowledgement, make sure you do it, because you get back there, you're damned if you do and damned if you don't.
Well, like you, yeah, thank you. And like you said, the whole hospital, everybody there works so hard. Everybody there is so interested in making the hospital a success. But there are two people who stick out in my mind. The first one is Hazel Filbert Thomas. She's our vice president of quality, and she handles all the statistics, all the numbers, all the policies and procedures. And when CMS came to do their survey, they gave her extreme high praise during their exit conference. Three of the surveyors called her by name, said that in all the hospitals they surveyed around the country, they've never found someone like Hazel Filbert Thomas. She is really, really amazing.
You make sure her contract having a clause that she can't leave for the next 50 years, okay?
Right, exactly.
The way you're talking, somebody going to try to steal her from us.
Yeah, no, she'd say right here.
In Hazel's spearheading all the prep work for our Joint Commission accreditation, which we hope will be in September. And she assures us things are moving forward as planned.
We have a caller?
All right, yeah. Good day, caller, WSTX.
Yes, good afternoon to everyone. I'm just tuning in. Am I correct in hearing that CMS is accrediting Juan Louis again in spite of the credentials of the current CEO?
Okay, yeah, I'll speak to that. First of all, going back to the threat of decertification, Juan F. Louis Hospital never lost certification, not even for 5 minutes. We never lost certification. They threatened to pull it away. We then were given the opportunity to enter into a systems improvement agreement with CMS, stating that we will do certain things in order to improve our systems, our operations, to maintain certification. Normally, hospitals in the States are given 2 years to complete a systems improvement agreement. CMS gave us only 9 months. And we did that. We did it successfully in 9 months. And our current CEO happened to be the COO during that period of time. And Dr. Ken Okolo, he did amazing work as a COO, the Chief Operating Officer of Juan F. Louis Hospital. And we, the board, I don't know if you tuned in early enough to hear that I'm the chairman of the board, Troy Dechabert-Schuster, and the treasurer of the board.
You're Troy?
Yes, I'm Troy, yes. And Phil Arcidi, the treasurer of the board, is here with me on air today. We, along with our other colleagues on the board, approved Ken Okolo to be the CEO of the hospital. Now,
knowing that his degree was invalid.
Okay. Now, let me...
Will you say that, sir?
Okay, let me...
Knowing that his degree was invalid. Yes or no?
Now, I must say that...
Yes or no?
The job description...
Yes or no?
Now, you're not here to interrogate me. I will speak.
Yes or no? Knowing his degree was invalid. Yes or no?
Ma'am, first of all...
Listen, he already answered. Thank you.
Yeah, okay, that's fine.
Okay,
but I'm gonna let you go forward. But you know, folks, what you're doing isn't right. If you have a bachelor's and a master's and a doctorate, okay, and you apply for a job that requires a bachelor's degree, okay, and you get that job, and as I've found out in the last 3 or 4 years, a lot of institutions that were borderline financially were not able to keep up whatever they had to do to be accredited, and all of a sudden you come from a school, you got a degree from a school that doesn't have accreditation anymore. You got a degree from a school that doesn't have accreditation anymore. But the fact of the matter is your doctorate degree is not the one upon which the linchpin of the position is attached to. And just because your school has a problem don't mean your brain have a problem. Now, whoever want to feel how they want to feel about it, that's fine. But let's be fair. That's all I'm saying, okay? Yeah. Because I don't like what it is that I'm hearing there. You know, I got my bachelor's degree. It wasn't from Harvard, okay, but they're accredited. And if tomorrow that school goes out of existence totally, as some historically black colleges have gone out, or merges with someone else and becomes on a new identity, then it becomes something else. So anyhow, yeah, so I just want fairness.
I'd like to add some more commentary there from the perspective of the board. First and foremost, the official job description for the COO position and the CEO position state clearly that only a bachelor's degree is required for both of those positions, believe it or not. And a master's degree.
I just wonder, in the CMS requirement for an administrator of that hospital is bachelor degree. That's why the job description matches that.
That's
so
right.
When the previous caller said, "Oh, we don't have CMS certification," that's the most ridiculous statement that I've ever heard, and someone not knowledgeable of the facts.
Yeah, so, and furthermore, our job description says a master's degree preferred. Canton has both a bachelor's and a master's degree from accredited institutions. The PhD is of no consequence to us. We did not look at his PhD when we were considering him to be COO nor CEO at all. It means nothing to us. If he never had a PhD, he would have still been the CEO. And again, as Phil said here, CMS doesn't even require for the CEO to have not even a master's, only a bachelor's is required. So all of this hullabaloo about him having a PhD from an unaccredited institution is of no consequence whatsoever.
Well, I hear you, but I guess folks need something to talk about.
Yeah.
Okay, and we move forward because, as I was stating earlier, you got folks in school. All of a sudden, their school goes bankrupt. It doesn't mean that they didn't have good teachers or whatever, but now they'll never have a degree from that school. But they just invested 2, 3, 4 years toward a degree that they may not even be able to transfer to someplace else. Education is one of those gauntlets that you have to plan in terms of going through. But a lot to do about something that doesn't factor into the very job description and advertisement that you put out there when you put out to get
And it's a non-issue and shouldn't even be on the table.
Right.
Okay.
And I must say also that the board, we have full confidence in Dr. Canton. We support him. We're happy to have him as a CEO. We continue to stand with him and to stand behind of him, encouraging him and cheering him along. He has done great work for Juan F. Hospital as COO and even as CEO. And he has a lot of wonderful projects on the drawing board, which will come to fruition in the very near future. We're very satisfied with him.
He better, because
Yes.
I'm not here to defend him.
Right.
Fair is fair, but we want performance. Okay,
Absolutely.
we want performance.
And so,
That's what counts.
And the board wants performance too. The board is there to make sure the highest quality care is going to be delivered at that institution, and every one of those executives in that hospital are going to be held accountable to meeting our expectations and getting their job done. Because if they don't, they're not going to be at that position any longer. We have no qualms about removing somebody who's not meeting their responsibilities and what requirements are set out within their job description as well as the board's expectation. It will not be tolerated.
Well, I just want to say that us talk show hosts, we can be real nice guys and girls, or we can be some real mean and take you apart limb by limb, okay? And all I'm saying in that context is that, hey, fair is fair. Let's stick to the things that matter, okay? The credentials are there and in place. Let's move forward and get our hospital to being the best hospital it can be in the region and maybe even win some international honors. Let's move forward. That's where we need to be going. But, the red herring, once you put herring and the dog knows he can't follow no trail, okay, that's a red herring. It's not applicable to where it is that we want to go. So let's get refocused on where it is we want to go, which is to make sure that we can persuade the folks in Washington that, in fact, the formula by which they fund our hospital is grossly outdated and bring us into the 20th century, 21st century, 22nd century, move forward to looking toward the future, because America is going to be great if America is healthy and America has the best education in the world. Health is the foundation, education is part of it, so we've got to focus on this, and that's where we need to go.
That's right. Absolutely.
Yeah. So anyhow, you're going to hear tomorrow Doug Canton was in here defending the hospital. Hey, ain't nobody could be hard on the hospital in Canton. You got people out there tell you that. But the bottom line is not to be hard.
Yeah,
we focus.
Yeah, one thing we want to leave off on, because I know we're here to 2 o'clock, is if Troy can speak about the infection disease issues relative to some of those things that we're asking Leahy to do, and where our statistics on the Virgin Islands are much higher than stateside.
Yeah, so one of the specialties, going back to Leahy, one of the specialties that we've asked them to provide us with is infectious disease. We know here in the Virgin Islands that we're constantly faced with the threat of Zika. That's becoming a major issue here and globally. We are faced with dengue fever constantly. Many of our citizens have already experienced dengue fever. Also looking at HIV/AIDS, we have the second highest rate in the world, next to sub-Saharan Africa. Also, there are a variety of other infections, whether it's methicillin-resistant Staphylococcus aureus or C. difficile, or any other kinds of infections that one may come up with, or it might be a simple sinus infection or bronchitis. And right now, we have no infectious disease specialist on this island. There's one in St. Thomas who comes over here, I think, once a month for a couple of days, but it's not nearly enough to take care of our patients, especially those suffering with all of these various tropical diseases and HIV/AIDS. So we're looking forward to Leahy sending in an infectious disease specialist to help us in these areas.
All right, and as part of your last words, I want you to revisit Leahy and the Children's Hospital. Explain to our folks who may have tuned in late as to this relationship that we're working on and developing, so that when you leave out of here, the good stuff is in their mind that's coming from this partnership.
Yeah, so in the very near future, we're actively working on a contract now with Leahy Hospital in Burlington, Massachusetts, right outside of Boston, one of the top 50 hospitals in the United States, and also with Boston Children's Hospital, the premier, the most lauded, number one children's hospital in the United States and among the very best in the world. So these two hospitals will be entering into a comprehensive partnership with us to help us to improve our systems on every level, as well as to send in physicians in specialties that we cannot support here on a permanent basis. We're very excited about this partnership, and we hope to see it kick off this summer, probably by late summer. So we'll start seeing physicians from Leahy and Boston Children's here on a referral-only basis, so your primary care physician can make that referral for you. And then we will also have the opportunity to send patients from St. Croix up to Boston. We're working on all of those fine details and logistics with air ambulance services and commercial carriers and so forth to receive the very best of medical care in Boston with these two wonderful teaching hospitals associated with Harvard and Tufts and other outstanding medical schools in the Boston area. So we're very, very, very excited about that, as well as many other items on the drawing board.
Well, I'm excited by it, and I think it's important that you got the opportunity to state that, again, good things coming down the pike, okay? As I said, when you go up to Massachusetts and start talking about healthcare, you're in the big leagues. And, you know, what better to do to say if we can go and bring the Spurs down here to train some of our folks to become the best, all right? That's the same way I look at it. So, folks, get on board, be a part of the solution. I'm not saying don't criticize, but don't take anybody's words for it. Find out for yourself first and make sure that your hospital delivers for you. Because after all, it is your hospital.
Thank you.
All right. Thank you. We'll be back in a minute. Thank you for visiting us, Juan F. Louis, and I look forward to many more such visits.
Thank you for having us here.
All right.
Thank
great.
you.